CD changer too.
Right.
Andy, did you have a CD changer back in '96?
I don't think so. I just had one of the, the in dash, just the one. Sorry, I wasn't high tech with the disc changer.
But I mean, you're like Mr. Alpine, Rockford Fosgate. I mean, come on, man. You're like all about the car stereo.
Used to be, yeah, but I just stick to the one CD. I don't need to change. It's not like it took a lot of work to put a CD into the thing.
That works.
Well, we have Janela Carrera, the spokesperson for public health. She's in the Zoom room. What about you, Janela? Did you have the CD player?
You got a CD changer.
In my car? No, did not. I don't even think I had the CD at all, just the tape.
The tape
That.
Yeah,
Oh,
I had
nice.
the cassette also.
Yeah.
You know, I used to do radio way back. Did you guys used to have the carts?
When I
Yeah,
started,
absolutely, yeah.
I didn't have cards.
You
so-
go. You didn't. You didn't.
No, it was all digital when I started. So
Yeah,
You're
Vic
lucky.
is new. He's young.
The carts were pretty bad. They were like huge. But anyway, Janela, how are you doing?
I'm okay. Haven't had a day off this weekend. We had our weekend community testing. So, but we're really glad we were able to offer it this entire weekend. Spirits are high. Everybody is very, our morale is very high. So and vaccines are going to be coming soon. So we're preparing for that. Public health is very, very busy. Christmas is around the corner, but nonetheless, we're glad that our cases are starting to go on a downward trend, and things are going well for our island. So we're really happy about that.
Right. And let's talk about the community mass testing. How did that go over the weekend? What was the turnout?
Actually, the turnout was really well. In fact, the Judicial Parking Lot Center yesterday went over 200 cases, or I'm sorry, not 200 cases, sorry, I misspoke there, 200 tests. So, the limit was 200. That was supposed to be the limit, but they did 220 tests yesterday. And I believe the mall also went over 200 yesterday. GPO was a little slow. We didn't quite reach that number. I think we only went a little over 100. We're not sure why GPO was a little slow, but nonetheless, we're overjoyed with the turnout for this time around. The week before, when we did the daily testing in Teadsden, Gigo, and Agate, the turnout was a little bit lower, but this time around we saw a really good steady flow at the mall and at the judicial parking lot. And we're just really glad that we saw the numbers that we saw. So to recap, we did the 3 days. We did 1,237 tests, and of that, 37 were positive. So that's about 2.9%, or rounded out 3% test positivity rate. So still a very low positivity rate. We're really glad about the numbers that we're seeing. And something neat that we did this time around is we offered Guam COVID Alert app codes, which we didn't really do in our previous testing. And so total codes that we issued is 8. So something new that we offered this time around.
Well, congratulations. Hopefully, are we going to see any more community mass testing?
So we're in preparations for the vaccine rollout.
Okay.
We're going to be focusing more on that now that the EUA has been granted. We're waiting for the ACIP and the CDC recommendations. So that's something we're going to be focusing more on now. We're probably going to be halting for now the community testing so that we can focus more on the vaccine rollout.
And we can get more in depth on the vaccine rollout, but we do have Crystal Pacos and Augustine in the Zoom room. We're going to bring her in now because, you know, something that we have been saying when the governor stopped by our offices on Giving Tuesday when the CAR score had dropped significantly. And she said that, you know, if we keep it low, she would be inclined to further ease restrictions. And she gave a date, and it was December 15th, and she said possibly 16th, maybe the 17th. Well, today is December 14th, and so we wanted to bring Crystal in to see if there's going to be any further easing of restrictions. Good morning, Crystal.
Good morning, people of Guam. Thanks for having me, and I just want to say kudos to public health over the weekend for really doing an amazing job with our community mass testings. Again, free and no symptoms, and we saw a great turnout, and we continue to stop COVID-19 cases, you know, from becoming a bigger problem with community spread. And so this afternoon, Governor Leon Guerrero is expected to make an announcement relative to a conservative lifting of some restrictions. I can kind of delve into some of those details. Social gatherings, we can expect a conservative increase in the number of people. Right now, as of today, it's no more than 5 people. We can expect an increase in places of worship, for indoor places of worship, for retail. We do know it's that season, and for outdoor dining. What I can tell you, you won't be seeing in today's easing of restrictions is you won't be seeing opening of indoor dining at this time. You won't be seeing opening of bars at this time. And again, we want to be very conservative with our opening. We know how delicate the situation is, and the people of Guam have been doing a great job. I just want to say that for these past 2 weeks, you know, when we rolled out the Strive for 5 effort, we announced the CAR score, we unveiled that formula, we were at the 40s. You know, that was at the peak of our construction clusters. And so to see the progress and to see that, you know, the CAR score truly correlates with our hospitalizations, with our death counts, with our positivity rating, our positivity cases. And so, again, kudos to the people of Guam. Thank you so much for being so vigilant about, you know, sticking to the guidance, especially as, you know, it's the holidays. We do want to gather, but we want to make sure that we don't open the floodgates. We don't open, you know, don't open everything all at once. We all know that that's a disaster waiting to happen. And we also want to be mindful that our nationwide, our partners, they're seeing spikes. They're breaking records, and not the good kind of records. We're seeing a death toll count on the rise in the States. And so we know that we probably won't be able to tap on those resources as much as we were able to in this current spike, that spike we just saw here on the island. And so we know that our resources are still limited. We know that our hospital workers they're tired, and we know that we want to prevent a third surge. So conservative is the way to go. Again, Governor Leon Guerrero will be making an announcement this afternoon. We'll see an accompanying executive order to correlate with the changes, and a public health updated guidance relative to these changes I'm talking about. Again, social gatherings, places of worship, retail, and outdoor dining.
All right, and definitely, as you mentioned, no changes, no lifting of restrictions for indoor dining, and there will be no bars opening, right?
Not at this time. Again, maintenance. Now that we've hit that 5 mark, right, the Strive for 5, we've got to 5 and below. It's about maintenance. And so in speaking with Dr. Felix Cabrera, the author again of the CAR score, 2.5 and below is really where we want to be. It's where we were most of the summer months. Hey, if we can get even to 0, to those days where we used to report 0 new cases, that's the ideal situation. And again, holding out for Christmas, we could see more easing of restrictions by Christmas. Christmas is still about 2 weeks away. So if we continue to do well, Governor Leon Guerrero is inclined to lift additional restrictions for Christmas and maybe New Year's. But again, we're so close to the vaccine, a lot of optimism and anticipation for that. And so if we can continue this maintenance, then we're well on our way to a better 2021 and bigger gatherings and a larger scale 2021.
Mm-hmm. What about the P Core? Will we see any changes to P Core 1?
You know, I haven't got the full update on the P-Core 1, if that will be changed. I'm actually going to go into a 9 o'clock meeting with the governor and get more details about direction from here on now that we're starting to lift restrictions. So again, the restrictions that I'm referring to, the lifting of restrictions, it would take effect per the draft EO that I've seen. It would take effect tomorrow morning at 8 a.m.
Okay.
So this afternoon, I'll have more information.
All right. Thanks a lot, Crystal.
Thank you for having me.
All right.
Okay.
Thanks. Have a good day. Janela, wow, you guys really are busy. You got to come out with the guidance in a couple of hours, or is it already ready to go?
Yeah, anytime there's any changes to the executive or any new executive orders, of course, we have to accompany that with a public health guidance. So now that we're aware that executive order may be coming out, of course, we're going to, start working our butts off to get new guidance out. So I'm sure our team is aware of that, and we'll start drafting the guidance to come out within the next 24 hours of the executive order. So that's another task at hand for us.
Surprise!
We have vaccines coming out soon. And I'm sure that with the mass testing, and also rapid engagement team, that's still something that, we have, in the works, and something that we still plan to do, because it's still very important for us to continue to do that kind of service for the people of Guam.
Mm-hmm. So with the vaccine, we had Annette on last week. We had Public Health Director Art St. Augustine talking about the different phases, and the vaccine committee that's going to be meeting again. Is there any new information on, or any changes in terms of how many vaccines we're getting, when they're expected to arrive to Guam? Because they're already starting to roll them out in the mainland.
Yes, so now that the EUA has been granted, we expect or are anticipating the first shipment to arrive within 3 to 5 days. But of course, we can't begin to administer the first doses until the ACIP and the CDC recommendations. And then our next order, we can place that on December 18th. And then the third order, 3,900, will be placed, which we're still waiting to find out when we can place that. Now for the Moderna vaccine, we have been given the green light to place that order as well. However, we're not sure exactly. I think we haven't, there is a date. I'm not sure exactly when that date is. Mm-hmm. And we've also been given a number. I think, I have to check back on the exact number of doses we can place. If I'm not mistaken, I think it's in 2,000 to 3,000, around that number that we can place that order. But again, with that one, we also have to wait for EUA authorization, and also ACIP and CDC recommendations. So that also has to go through that same process as well. I'm not sure, but I think the ACIP and CDC recommendations are already being made. So that could be, any day now. It may have already even happened. I have to check to see if that has already been made.
Okay.
So things are happening really, really fast, and sometimes it's hard to keep up with all the information that's being mm-hmm. given. Mm-hmm. So it could really just be a matter of talking to Annette and then getting back to you, and press releases are happening or being doled out in the next few hours.
Right. I did want to follow up on something, because now that we're hearing that the easing of restrictions, this executive order will be coming out later this afternoon. I wanted to ask for follow up on the citations and penalties, whether or not any have been issued, or whether the staff received the training on how to issue citations, because I remember when I spoke with Crystal the day before Thanksgiving, she was talking about how the staff at Public Health, they'll need to get trained before they can issue the citations, and in the interim, the police department was going to go out there and handle the enforcement. So is there any update on staff at Public Health?
That's right. So the training should have occurred this past weekend. I believe it was on Saturday that they should have received the traffic citation training. And once they receive that training, they should be able to begin issuing citations. And so that's pretty much similar to being able to issue traffic citations. And from then on, they'd be able to, if they find any violations with the executive order or public health guidances, then they'd be able to issue those citations. And now how it went, I just have to talk with our Division of Environmental Health to see how it went and how many people went through that program. Now, as far as the Guam Police Department, I'm not sure if they've issued any citations or fines, but we have at Public Health, we have received some complaints, but because none of our employees have gone through that training at that time yet, we had not been able to issue any citations. And I think it was a good thing for the public because it gave them time to really be able to familiarize themselves with the enforcement rules. And so anytime a complaint came through, and if we went out and inspected, it gave us time to really educate the community and the public that, this is a violation. And, in the future, you may be issued a citation or a fine. So it gave them time to really understand what this violation meant. And that if it were to occur again, and at that time, if we had officers or deputized officers, and it were to happen again, they may receive or be given a ticket with a fine attached to it.
Okay. Well, thank you, Janela, for the update. Was there anything you wanted to press out to the public before we go to GMH?
Just want to coming out this past weekend for all their support and all of our partners, of course, as well. GPD, the Guard, Guam Fire, UOG nurses were out. Really grateful for them. The Mayor's Council. Trying to think DPW. Who else we need to thank? Just a great turnout this time around, and also just want to remind the community that vaccines are coming soon, and we'll be really doing our best to educate the community about the everything that you need to know as much as we can about the vaccine. So look out for that. And we'll do our best to put that information out through social media, through our website, and just stay tuned, and through our media partners as well. Thank you to KOM for always being gracious hosts to us.
All right.
Thank you very much.
Anytime, Janela, you need us to get information out, we're here. So thank you, and have a great day.
Thank you. You too. Take care, guys.
So we're going to continue in our Zoom room where we have hospital administrators.